Welcome to day 2 of this e-workshop on wastewater-based COVID-19 surveillance. And today program, we will have just dialogue sessions, and we have separate the session dialogue into 3 separate sessions. First, for the first hour, we will talk about planning and sampling, and we'll take a 15 minutes break, and then we will follow by dialogue session 2 on sample handling and analysis. And after that, another break before we continue with session 3 on data analysis and reporting. All right. So let's start with dialogue session 1. All right. So it's my great pleasure to chair this session. And with me is Professor Husman, and also Professor Manish Kumar. And we have another panelist is Professor Snyder. All right. So Professor Husman and Professor Kumar, I have introduced them yesterday because they gave a talk. I would like to introduce Professor Snyder to all of you. He's, I think, I will believe most of us who work on wastewater must have heard his name before. He's currently a professor of civil environmental engineering and is also the executive director of the Nanyang Environment and Water Research Institute at Nanyang Technological University, NTU in short, in Singapore. Dr. Snyder has worked as visiting professor at NUS since from 2011 to 2017. For last 20 years, Dr. Snyder's research has focused on water quality, treatment, and sustainability, which resulted in over 250 manuscripts with over 26,000 citations. He has served on several US EPA expert panels, including the Science Advisory Board Drinking Water Committee and the Board of Scientific Counselors Sustainable Water Committee. He was a member of the US National Academy of Science National Research Council Committee on Water Reuse, and also served on the World Health Organization Expert Committee for Development of Portable Reuse Guidelines. He has been invited to brief the Congress of the United States on 3 occasions on emerging issues in water quality, and he served as editor-in-chief of a couple of journals, including the ES&T Water, American Chemical Society Journal, and also Elsevier Journal Chemosphere. He's a fellow of IWA, a member of the WHO Drinking Water Advisory Panel. And he was featured among the top 25 leading water researchers globally by Lux Research, and was awarded the 2015 Dr. Pankar Park Research Innovation Award from the Water Research Foundation. He also received the Agilent Thought Leader Award in recognition of leadership in water sustainability, safety, and treatment in 2017. And he and his team was also awarded the Nanyang Humanitarian Award from NTU Singapore in 2018 for their philanthropic work in water and sanitation, which has benefited over 2 million people in underserved communities in Asia. So welcome, Professor Snyder, to the panel discussion. Now, just a quick briefing for all of the participants. During this dialogue session, if you have any question, please type it in the Q&A icon panel, and then we will try to answer your question. And if you like this question asked by somebody else, you can upvote it by clicking the thumbs up icon, so that we know this question, more people are interested. And you may also raise your hand by clicking the icon, and we try to unmute you so that you can ask the question to the panelists directly. Okay, so before I start the Q&A session, maybe what I'm going to do is I would like to invite Professor Snyder to just give us a very quick overview of his research program on wastewater surveillance in NTU, and also experiences that he would like to share with us. Professor Snyder? Yeah.
Okay, thank you so much, Yong. I'll remember to give you a smaller bio next time, but thanks for the gratuitous introduction. But so yeah, I'm happy to join in. I'll just keep it brief. A few things about what we're doing. We were funded on a project by Singapore PUB. So Singapore PUB is our national water agency, and the project was to do some level of surveillance. And I can talk a little bit about how we did that project. And then the other part is water treatment and the fate of the virus within sludge and different processes of interest to the country, which has been very interesting for us. Of course, we're mainly working with surrogate viruses, but that came with its own challenges and that we've had to overcome. So for the surveillance work, we were trying to figure out how to get as sensitive of a method that we possibly could. The main interest, at least at the onset of the project, which was we began sampling in June of 2020. So it was pretty close to the peak, I think, when we were having infection rates within Singapore. And we could see that at the water reclamation plants. So we began sampling every one of the water reclamation plants in Singapore, which is a benefit to having such a small country, that the network is very well known. So we could encompass the entire country just by collecting from the water reclamation plants here. And then with the help of Singapore PUB, we selected some potential communities to sample out of the actual sewer network. So beyond just the influence, the water recycling plants and the effluent, we also were doing various places within certain communities. And we encompassed a pretty good coverage of the country, but not nearly, I would say, the coverage that NEA did, Dr. Li Ching I spoke about yesterday. So just to make a few quick observations of what we learned along the way, it was very interesting for us to think about the timing of the sampling. So while we wanted to do composites, and we often do compositing, we actually saw better resolution when we took hourly samples and tested them. And when you think about, especially within the community, within the water reclamation plant, I think it doesn't matter as much. But once the disease incidence was very low, we were able to capture a couple of what likely were single cases, one in a community of 56,000 and another single case in a community of about 24,000. And in the second one, the 24,000, that was we're quite certain because the single person was found in that community, and we know the timing. So, so I guess in general, that comment about the resolution of how to take the samples and when and whether or not the composite wasn't something we spent a lot of time talking about and designing the project. And then we also had to think about how we were able to transport the samples back to the lab. There are certain regulations in moving raw sewage around and how it's classified as biological materials. So that was another one that we eventually had to overcome. We also, on top of just measuring the virus, like I think everyone on the call tonight has done, we are also doing chemical markers. So those of you who know me, you should know I'm not a microbiologist, nor do I want to pretend to be one. My expertise is in chemistry. So we did a whole portfolio of pharmaceuticals, we did personal care products, we did artificial sweeteners, and we were able to use that data to actually back calculate some of the population information. So beyond the flow rate and the total flows that were monitored at during the sampling, we also were able to get further resolution by comparing chemical markers against the flows. So I think that's probably the biggest things that we learned. We also, I guess I could add one more thing I had a note. We also saw some interesting data when we had rain. So here in Singapore, it rains a lot. And when we get rainfall events, we could see that the chemical markers were being diluted. So even though the flows were higher, we could tell by the pharmaceuticals and the other chemical markers that in fact the stream was highly diluted, which meant there was probably infiltration from stormwater or somehow impacting it. So I thought that was kind of an interesting one. When we normalized against the chemical markers, I think we got better data than when we just used the flow rate of the plant in the pipeline or the full scale plant. So with that, I don't know if I don't really have much else I think to add to it at this point in time. Probably want to get on with the panel. So turn it back over to Prof. Yong.
Hello, yeah, thanks, Shane. All right, so let's look at some of the questions that were posted, carry over from yesterday. So there's one for Professor Kumar. Do you think the current practice of disinfection in existing sewage treatment plants, for example, UV chlorination, are adequate by themselves, or there needs to be a combination with a membrane process, example, RO? Also, some places require residual chlorine in the effluent. Do you think that will be able to control COVID virus?
Yeah, actually, I touched upon this yesterday. But like I said, so this time I will be very brief in a sentence or two. Of course, like because of this enveloped virus, it is supposed to, disinfection process is supposed to kill them. I mean completely. So I said that chlorination or UV disinfection or even RO is not supposed to, but I mean it should get rid of these viruses. But what about this some nano-sized genetic material? How much they will be left out after chlorination? Because those things are a interesting thing to see. And I also correlated it with how a wastewater treatment is managed. Is also going to affect us, that okay, and whether the dosing is right or not, or this time a particular day, if there is a rainy season and all those storm water is coming, or combined sewer flow overflow, or the flow is coming and it changes the discharge, but disinfection rate remains the same. So there are several issues related to that. And in developing countries, where not only there is a scarcity of wastewater treatment plant, but at the same time, there is a scarcity of a skilled labor or the managers, if I would say. So of course, as a technology, there is no problem to control this virus. It cannot even live on a surface, even if it is not disinfected after a certain period. But yeah, but there are several issues to have. Of course, if there is no question, then I would like to add what Professor Snyder was telling about our this theme, planning and sampling. Can I, or after Anna?
Yeah. Sorry, Manish, what do you say? I miss you.
So yeah. My answer is finished, but I wanted to make some point on planning and sampling, and then yeah, and then or otherwise, if you, as you like.
Okay, you want to say something about planning and sampling? Yeah, please go ahead.
Yeah, so actually, it's nice to see Professor Snyder, who is also. Because I am also like him, not a microbiologist, but chemistry major or basic training. But what is happening is that you know, the planning and sampling is highly correlated with our objective. The recent paper, which I submitted for the revision, there we try to have zonation, not early warning. Early warning, so we have to understand whether the wastewater surveillance is being done for the purpose of early warning or for the purpose of assurance in a community, like a campus scale, whether there is any case is happening or not, or it is a kind of like a city scale. We want to see that which area is more affected. So objective is going to affect the sampling planning. So if we want to divide those zone or like that, and or we want to do the early warning, and so the number of the sample and the sampling plan is highly correlated with the objective. One point. Second point is that like Professor Snyder or anybody in this domain will tell you that there are a lot of diurnal. Yesterday, Bivnis was talking about diurnal variation, and even along the sewer system, there is a variation. However, if we take a sample at a given time every day. That means that you are keeping all the variables. Even variables can be kept constant, right? So even if if grab sample even, but if at a constant date, at a constant time, consistently, if we do at the same time, then perhaps we can handle the other variables or other effect, or at least we can say that this is what we are doing. So these are the 2 points I wanted to.
Sure. I think you raised a very important, you mentioned something important, is that what is the objective of the surveillance? So like for Singapore case, because our prevalence rate right now is still very low. So our primary objective is very much to see that where can we identify the cluster of infection going on so that we can isolate and then do tracking. We are still able to do that because of our low prevalence rate. But once you go to area where a lot of people are infected, so the objective, like what you say, after vaccination, what happens, what will be the trend line, and whether there's a drop in the infection, the number of signal, so that could be an indicator of improvement in the transmission rate of this thing. So yeah, I think it's important to understand the purpose of this surveillance. All right. So Professor Husman, do you have any comments on anything you'd like to share? Anna?
I guess with respect to sampling, I would like to stress how we use 24 hours composite sampling at the sewage treatment plants. But it's also interesting to know that at smaller locations, such as schools and nursing homes, where we also sample, that we now have this device that is called a passive sampler that we use in collaboration with the Australian groups. We're still evaluating. This is with David McCarthy from Monash. And that may be interesting when it's much more challenging to put in a composite 24-hour sampling cabinet. So maybe that's of use.
I see. So when you say the cabinet, is it a chill cabinet or just outdoor ambient cabinet?
The latter, yeah.
Oh, okay, sure.
Yeah.
All right.
Yeah.
Okay, so
because in our case,
yes.
We're not so.
Okay.
I don't think we're so influenced by very high temperatures. I think.
Yeah, I think so. Yeah. Okay, so there is a question yesterday because in my presentation I mentioned that the auto sampler was overheated because of the high frequency of sampling, and there are components, parts melted. Okay, so the question here was, does not overheating in the sampler kill the virus? Okay, so the answer is no, because the auto sampler that we use is a vacuum pump systems. So the motor itself doesn't direct contact with the tubings. It's just creating a vacuum pressure. So what happened is that why does it overheated and melted? Because we were sampling like every 2 minutes, every 2 minutes. And how the auto sampler works is that we can set the volume, and we set it actually every 2 minutes for 20 ml. And the auto sampler system, how it works is that it will keep pumping until the volume is exceeded 20 ml, and then they will discharge the excess and collect 20 ml. All right, so that is how that vacuum pump works. So what happened is that in this inspection chamber where the population or the source is not high, there are long periods where there's nobody using the toilet. So there's basically no water flowing. So what happens is that the pump is working very hard, and it is trying to suck the water for 1 minute without any water. So that could cause the pump to be overheated. Okay, and that was the reason why we have a melting of a diaphragm of this pump or this thing. All right. So in a normal situation where you do sampling at wastewater treatment plant inlet or in a big manhole where there's always some flow coming on, then you will not have this problem, in my opinion. Yeah. So overheating of auto sample will not happen in this kind of cases. So what we do now in Singapore is that we actually spread out a bit, reduce the frequency, means instead of every 2 minutes, we stretch it to 10 minutes. And then hopefully we can collect more water. Right? That's how we do it. All right. Okay. All right. Next question. Do you also experience low turnout for human testing and therefore wastewater testing becomes a necessity? I'm trying to understand this question. Low turnout for direct. Okay. So the question here is, any one of us, whether you experience low turnout for nasal swab testing, and therefore wastewater testing becomes a very effective tool for surveillance. What is your opinion? Maybe Anna, from your experience in Netherlands?
I guess in my experience is that our human surveillance is very well organized. And so there's actually quite a lot of test facilities. We also have other indicators that are very informative. So I'm not sure whether this is very applicable, or do you see that differently?
What do you think, Kumar? Manish?
No. Yeah. Perhaps here it will be a little bit difficult. Of course, I have, I mean, where we analyze our water sample, that is a very active center for human samples also. And there we analyze swab. But then again, it is like the whole idea of the wastewater surveillance is to have something on community scale, right? There are some clinical steps and those things. So the sediment or water or the swab, it can only increase the signal. It can it can amplify. But the point is that RT-PCR can amplify very, very tiny purgeons. So in this case, maybe the wastewater itself is good enough. But once we think about that, okay, the precipitation and some more variables, but we have to understand that the wastewater surveillance is indicative. It is a kind of supporting, I mean, the technique. So it doesn't need to be necessary to be that. I have a little bit confusion that whether it is necessary to go for that. That's my stand.
Where is that? Of course, in the early days, people were asking everybody to go for swab test, nasal swab test. Okay, and that we know is in the early days they use a very deep kind of nasal swab that is very intrusive in a sense. Right now in Singapore, they go to like about 3 centimeters in, combining with the swab from the throat. So it's a bit better. And of course, people talk about saliva testing. Now, but one point to note, I also I heard that in overseas university, some hostel or university impose that every student must do a saliva test like once every 2 weeks, something like that. So the point here is that unless you do a very frequent kind of like very routine saliva test or swabbing, because I may have done a saliva swab test today, but in 2 days time, in 3 days time, I got infected, you know. So there's no way I'm going to know about it until the next saliva test that I'm going to do maybe in 2 weeks time. So during that window or period, I may be going around infecting other people. So I think for wastewater surveillance, it become a very powerful, non-invasive test. Surveillance of, especially if we can track down cluster or areas based on the wastewater catchment of the network. So I think it serves a very important, useful tools in my opinion. Yeah. Now, there's another question is, how do you plan for non-sewer area surveillance? Is that possible for wastewater surveillance for non-sewer area? like area where they use septic systems, or decentralized small local system. What's your opinion and experience, any one of you?
Okay. I had little bit experience when in Bangladesh, I have to guide them from remotely. And so I was here who could detect it. There is no wastewater, but they were the center to analyze the human sample. And they wanted to extend their capability to the wastewater. Now, from where they should get the sample, that was very difficult for them. Even they bring the fresh fishes from the detention center. And but it sometimes it was amplifying, sometimes it was not amplifying. At the end of the day, we said that like you are analyzing, yesterday I have seen that how NUS is analyzing and not a single positive sample. So we cannot be like, we missed the positive sample. And that was happening in Bangladesh, that we were not getting the positive indication. Of course, the mistake was the wrong PEG was being used, but actually I am smiling this much because at the end we could succeeded, but there were a lot of a particular kind of polyethylene glycol only will work, not all PEG. So those things is a minute thing that everybody need to attention. But coming to the question is that I said, I feel as let's suppose X is a constant, then what is the relationship between Y and Z? So even if there is no sewer system, and if I am, you know that in my city, I am monitoring a river. Even I take the sample just because even there is no positive, it's fine. But science needs to be like given a chance. So I take the sample, and I have seen that how after the in 6 months, at the 5-6 occasions, even that river sample has shown the positive thing. Of course, if sewer system is not there, then we cannot give a good number that which area is affected, or where is this people coming, because we don't know that wastewater, what is the source. And if it is not streamlined, then we cannot pinpoint that this is where this virus is coming. But source tracking can be problem, but at least positive or not positive can be told. I think so. That even if you take a centralized system, you can take it and you can know that at least in this community somebody got positive, or there is at least we can say there is nobody if it is a negative result.
Okay, thank you. There's one question for the panelists. Has anyone tried more swabs in network in areas where auto samplers are not able to be used? And this is quite similar to another question, whereby if there's no inspection chamber or access to manhole, are there any other sampling techniques that can be used by grab sampling or these more swabs? What is your opinion?
So I think you should call Professor Snyder. You have to name it only then.
Shane, what do you think? Based on your experience, no manhole, can we do wastewater surveillance?
Frankly, I don't know. That's the answer. But I would say, I give a bit of a different answer. We have struggled though where to place these auto samplers, because some of them are like on public sidewalks, right out in the middle of the city that we've done. So we've struggled with where to put them, but we haven't dealt with a situation where there was no access. But I will say, I'll answer it back to the previous question. We have a project for surveillance in another country in Southeast Asia where they don't have centralized wastewater treatment plants, at least where we're doing our work. And we're getting the samples from, say, a community or even an individual building, but it has to go somewhere. So, these networks that we we're dealing with in remote areas of Southeast Asia, they don't have, that large city, so we're not going to be looking at the kind of resolution we would do in an urban area like Singapore. But we certainly know that the technique is valuable, especially in these areas and countries where they don't have maybe the resources to do the high frequency human testing on each person. I mean, that's the whole point. So we have contracted with the government of another country nearby here in Southeast Asia to do that. And I think it's very rewarding for them to get the data back. But unfortunately, it does take time because shipping samples and such is very painful. And by the way, while I'm on a roll, I'll add one more thing. You were talking about the auto samplers. One trouble we did have is that our auto samplers can't have a vertical lift of more than 8 meters.
Yeah.
So maybe some other people on the phone got better auto samplers than we do, but when we have more than an 8-meter lift, we couldn't get them to work. So that was another limitation. So just thought I'd add that in while I had the microphone.
Yes, and maybe
the same problem. I think about 7.5 meters. Go ahead, Anna. Yeah.
No, you go first.
Okay, I'm done. Yeah, we face the same problem. Once you hit 7.5 meter or 8 meter, we have trouble getting the water up from the manhole, right? Yes. Yeah. Over to you, Anna.
Yeah, so we do have experience on non-sewer systems with respect to antimicrobial resistance, for instance, where we actually take river water samples downstream from major cities as discharges from individuals and households when there's no sewer lines. And that seems to work well with respect to antimicrobial resistance, for instance. So if you want to look at antibiotic-resistant bacteria coming from the population and coming from their waste, this is also an option. So if there's no sewer lines. So that would be at a larger scale, actually.
Sure. So there's a comment provided by one of the participants, Rinuma Haig. Is mentioned that in Bangladesh study, they are able to identify the ORF1 and engine from the hospital septic tank, and they have collected from septic tank in front. All right. And okay, let's move on to the next question. This question for Shane. What are the key considerations in the sampling plan, and what are the resource considerations?
So, I mean, for us, I guess it was the resources first. We had a finite budget and we had a span of time in the contract. So for the Singapore study, so we worked with the national agency to think about, where were we definitely wanted to do the water reclamation facilities, but based on our budget, we could only take so many samples. So we decided to try the high frequency by the hour, for a while, and then we moved off into like more of the compositing later. But I guess the considerations that were really around the financial side, I should say too that we use a multiplex assay. So we're measuring five of the genes simultaneously, and that does increase our cost. But we've actually seen that to be very valuable because sometimes some of the genes are more sensitive than others. I know this has already been spoke about, but just to share with the audience that we actually are sticking with this multiplex 5-gene simultaneous measurement. So it makes it a little bit more expensive, but yeah, I guess that's what I really can say. I'm not sure if there's them specific. I guess the QA/QC was something that I was quite picky about, but that comes from, I think, the chemistry background. No offense to my microbiologist friends, but when we look at the analytical work at trace levels of, say, pharmaceuticals or whatever, we have to have so many blanks and so many replicates and so many spike recoveries. So I required that in our study as well, which also does increase the cost, but I thought it was well worth the effort.
Sure. Thank you. Now, there's this interesting question, and of course, let me see. Okay, I am wondering, measuring flow rate is how much significant for the detection of viral genetic material. If I spare wastewater treatment plant and consider community drain or surface water bodies. So this is a question talking about instead of wastewater treatment plant in front, look at the community drain or surface water body. That is the question. Okay. Anyone want to take this question?
So is it related to like surface
measurement? I think it's related to detection, you know. So what I see is that usually the virus is actually shedded through the fecals, right? And based on some study, even in the urine, you don't get so much of the viral load, right? So we must have sufficient feces capture in the auto sampler, all right? So it comes to a question that I'm always also puzzled about is that how frequent should you sample? Because initially I was also thinking about this issue. Let's say you do a sampling of every 15 minutes, okay? Every 15 minutes collecting 100 ml, all right? So what happened, and if you look at the auto sampler, the suction time is very fast, okay? If there is water in the sewer, okay, there's sufficient water in the manhole to suck 100 ml is like 6 seconds, your job is done. All right, then you stop for next 15 minutes. All right, what if somebody discharged the wastewater during that time interval? All right, and then there are a lot of toilet flushing, especially if your catchment area is big. So what is the detection limits, or how 1 out of how many population you can confidently detect it within, let's say I'm infected with the virus. Let's say I have infected for about 2 days, okay? By when can you detect? Let's say I live in building blocks of 500 people, you know. How confident are you going to detect my signature in the manhole, you know? That's a question that I'm also very curious. Anyone can help me answer this.
Not only you, but actually all of us here is wondering about this. And that is why the gene number or the gene copies still could not have been found in number of people infected. Here, it is good that in your community only you are positive, but let's suppose that 5 got positive. Can I tell that whether it is not 1 or more than 5? So I told, at least we can say that no, somebody is affected here. That we can say, but can we say 10 or 5 or just only 1? So even that is a question. And yesterday also I talked one thing about the spectrum. A spectrum means the CT value that I started in around April, May last year is the same kind of thing I am getting now. Of course, there were fluctuations week by and going down and going up and going down. But what is the spectrum being reported and for how many populations? So COVID-19 cases has, the cumulative case, whether the cumulative case has the effect on the gene copies, whether the active case is more related, of course, Arun was telling about 2 weeks before active case rather than those things. So what to match and what is the spectrum, what is, so those questions are very interesting, but, and I think gradually the kind of researchers are working on it. They will, we will dig into it and try to find the answer that what is there. But as of now,
Yeah. Okay. I think anyone else beside the panelists, the 4 of us here, other speakers who are online, you'd like to have any comments on this question? Please feel free to do so.
I think in the meantime, while we wait for people to wave, I have a short comment. What we noticed is how if we put in auto samplers at a smaller location, so with fewer people being at the location and also fewer people being infected, the signal gets more erratic. So it's more difficult to interpret. You get more peaks and then non-detects in the meantime. And also, if you put in an autosampler at for instance, a school where there's no flushing during the nighttime because there's no one there, then that gives problems. So in such situations, we'll just turn it off at night. I don't know if those two remarks are helpful, but that's our experience.
Yes. So I think that is true. In fact, some of the auto sampler can have that flexibility. Like at night, you can just off it. It's programmable. So you can activate it at certain time of the day and what kind of program you want to design for it. So in fact, a lot of the auto sampler has now that capability for flexible programming. Yeah. Certainly, if there's a long period of dry, you should stop it. Yeah. Okay, now next question is how long the virus can stay in the wastewater? Okay, anyone want to take this question based on your experience?
I'll throw out a comment. You know, one of the things that we've noticed is, at least in chlorination, even at extremely high doses of chlorine, the genes are still present. So it is very robust. Now, through across the treatment process, even a minor amount of coagulation can take it out. We've seen very low doses of coagulant have multiple log removal, and even a small dose of coagulant aid like polymer makes it even higher. But what was shocking in Singapore, at some places, chlorine was being added into the wastewater, into the sewer, into the network. But yet, even with very high chlorine residual, we didn't see a change in the positive. So we did it in the laboratory and even did electron microscopy to show the TEM of the virus before and after chlorine. And it's not viable, but it was still detectable. So it's something important to remember, that even we were doing a CT with like 16 milligrams of free chlorine, and we could still detect that virus even then. So
sure,
something to think about.
That is good for, I mean, yesterday I have shown during my presentation that how consistently we are getting in the effluent. And I also compared with root zone treatment and also the active sludge process. And in both cases, after the treatment, we consistently got this. And I also had a great belief that because of the colloidal nature of it, it is going to work good. Coagulant can work better than the disinfectant. But my question, of course, among the panelists is that what is your take on this viability and infectivity?
That's a dangerous topic, I suppose, for a chemist. But what I'll say is what has been interesting, and then one of the experts on here, like Joan or someone, can counter it. But we've been working in the treatment case with two surrogate coronaviruses. So obviously we're not a BSL-3 lab at NERI here at NTU, so we're not culturing the actual SARS-CoV-2. But with the two surrogate coronaviruses, we see that we do focus forming assays. So we do the viability test. And what I can tell you is that by PCR, same thing. When we do, say, the chlorine, we don't kill this virus, so to speak, but by PCR. But absolutely the viability is gone. I mean, we like 8 logs reduction we were achieving with chlorine. So with high CTs, but I think it's an important point. I can't say exactly for the SARS-CoV-2 other than real samples that would be chlorinated. But with the surrogate coronaviruses, it's pretty remarkable how the viability goes down very, very quickly, but yet the PCR seems to just continue to pick it up. And one hypothesis is that when they're setting up these PCRs, they look for the most resilient segments of the genetic material. So I don't know if open up for a discussion, but I was really shocked that we couldn't knock out the PCR with chlorine. That surprised me.
Okay. All right. And maybe Shen, there's a follow-up question for you. Just now you mentioned about your QC control. Can you elaborate on control, replicates, and validation procedures used?
I can, mainly for the sampling. For the actual assay, of course, I have a wonderful team and probably on the call listening. But so what we require is that with every sampling event, we have blanks that are prepared for us in the actual bottles. Everything's the same, handled the same. So like, I guess we call that a field blank that we run the whole way through the procedures. And then we also have within the laboratory, you know, we have a positive, of course, we rerun the samples again. And sometimes we've even done rerunning them with the non-multiplexed assay. We also do spikes. So what we spike, of course, we're spiking in the RNA, which I think Janelle, who's on the call, we have a very interesting discussion about that. So we would actually spike the raw RNA into the samples. So we do that quite frequently. And I think some people were surprised that we get good recovery. So this is not a virus being spiked, this is the actual RNA being spiked. And we look at the recovery through that. So, I mean, that's the essence of it. Replication, having samples that we have true replicates of the samples, the blanks, and then within the assay itself, there's a lot of QA, QC. But.
Okay. Now, these next two questions are kind of pretty similar. First one is, how did climate variation and rain affected the sampling? How did you overcome such issues? And next question is, what are the challenges faced in combined sewer sampling? And how do you overcome these challenges to get accurate results?
I mentioned that a bit in my presentation about the rain. So absolutely the rain does affect, even in Singapore where it's not a combined system.
Yeah,
it's definitely diluting the way we deal with that is by using chemical markers. So we've done extensive monitoring to pick, you know, several markers, including artificial sweeteners, things that are relatively constant that don't change a lot among our water reclamation plants to try to help normalize for that dilution water, if you will. And in a combined system, we haven't tested one, but I'd be shocked if this was a very viable to be running it during a rain event in a combined sewer system where the majority of the flow is going to be from the rain, from what I know in my previous history in the States.
Sure. Anyone else have any comments from the speakers? Do you have any experience on a combined sewer?
Yes, we do in the Netherlands.
Okay.
And we use water flows to correct the numbers that we observe. And also electric, I'm sorry, I don't know how that translates. Sorry, conductivity, is that what you say?
Yeah.
Yeah, so that's the way we go, yeah.
Yeah, here actually we are sampling mainly the CSO. And in that case, of course, because of this chemistry knowledge, I always go with this EC and TDS and in situ parameter, I always analyze along with the sampling. I never stop doing those in situ parameters. And that one thing. Second thing is that the internal control, sometimes, I mean, many people accept the variation in the internal control. They report it, that is the variation. But in my case, what I have done is that I didn't accept that because I know that I have given a certain amount of the internal control. It should correspond to certain city values. And if it is not, then I change the amount taken, even add some more filtration step and or more concentration step. So that at larger concentration step, maybe the interference and those things or dilution effect may be minimized. So sometimes we analyze the given sample several times.
Okay. All right, next question. What is the best precaution for sample handling during testing in the lab besides from PPE? Maybe this one, okay, anyone want to answer this? Okay, or we leave it to the next session. those guys who do in the laboratory, session 2. Okay. Let's pass this question to next session. Let me see any other question. Anyone have any more questions? Okay, what are the precautions for sample collection contractors or personnel? What are the precautions required for sample collection contractors or personnel?
Well, in our case, we looked at this at the early stages last year, when it was first noticed how SARS-CoV-2 can also be present in feces, and therefore also in wastewater. And we found that if we adhere to the regular PPE that is already prescribed for other pathogens and other hazards, then it's also safe for SARS-CoV-2. But it's sometimes difficult to communicate widely and have people not be very brave, but just wear the PPE as prescribed. But again, if you adhere to it under the circumstances that it's prescribed for, so it really depends on what you do in the sewer lines. Are you in the sewer lines? Are you beside it? Are there aerosols? What is the work that you're actually doing? Then you should be safe, because you need to protect yourself anyway from other pathogens as well, such as Legionella, for instance.
This is, I have a strange problem with this, that gradually my team, initially they were very afraid, they don't want to go for sampling. Then they were very precautious. And gradually, like the many literature coming and saying that it is not infective, they are getting careless. Or they are like, oh, no, there is in wastewater, they will argue. Then that's why I try to say that still it is not proven. So it's better to be on the safer side. But yes, again, it is related to that whether actually it is going to be, in the aerosols or those in the breezes, and that's why it can affect. Otherwise, people with the simple gloves and those things handling the right way are doing it. And whenever we talk about the infectivity, because not after the treatment, where there is no treatment plant in those places, like one question was there that if we will be swimming, or whether we would have any infectivity issues or not. So these all are related. Of course, I have not done research on this infectivity issues. So maybe other panelists can shed light on that.
Okay. Now, one more question. Any experience in sampling in wastewater system that have significant inputs from industrial discharges? Anyone have any experience?
We certainly do. We have one of our sites is predominantly industrial, one of the water reclamation plants in Singapore. But we wanted to be inclusive because several of the dormitories also discharge into that same sewer, so it is mixed. But it really has a unique signature chemically. You can see it clearly even when we do the extractions for the chemistry. The water, even the final extract, looks different. So we have experience. I don't know what kind of experience they're asking about. We have tested an industrial sewer, one that's contributing a lot from industry.
So the challenge here is that if you've got industrial chemicals coming in, will that reduce your detection of COVID viruses? Any experience on that, Shen?
No idea whatsoever. I don't even know how to even begin testing that one, but it's a great comment, and maybe it's so. But now that the pandemic, or I should say, the number of infections in Singapore is quite low. What we know is our false negative rate, which is very, very low. So it seems like it's been doing pretty well, but I can't tell you for sure if the industrial effluent somehow impacted and gave us a false negative. That I don't know.
Yeah, I think so. Yeah. Now, next question what is the potential impact of COVID-2 virus carry over to potable water system in the reuse of treated wastewater for direct potable water? What's the likelihood of that?
I would say extraordinarily low, if because at least the DPR systems I know of in Windhoek and Namibia, or even the new water system here with MF or UF, reverse osmosis, UV advanced oxidation,
Yeah.
I would find it pretty striking. Even the number of gene copies we're seeing in the water reclamation plant and the raw sewage is very low. Even for a conventional type plant, we really don't see much in our study with the effluents, but I would think pretty low probability there.
Yep.
I agree. Yeah.
Yeah. About this industrial effluent, we did classify some of the industrial effluent and then try to domestic and rural, urban. Yeah, I mean, now we have to sit, but we have already classified the sampling in such a way, standardized that. My hypothesis is that maybe even if those people who is asymptomatic, or there are the many people who are, I mean, now still some industries has begun working. I will report some of the findings very soon. Yeah, it is coming positive.
Maybe Yong, I'll add one more thing on the reuse. So what I was going to add in, it is interesting to look at the brine of the RO.
Yeah, I
in
think
these
so.
reuse systems, and we have detected it in the brine streams. So, but
yeah,
the viability we don't know. So we're going to begin. We're actually putting our surrogate viruses into the brine to see if they are somehow inactivated for the surrogates. But we know we can detect the SARS-CoV-2 by PCR in the RO brine after we in a advanced reuse plant.
You mean from new water plant?
I can't say specifically.
Oh yeah, okay. Okay, there no. Okay, now have any of the panelists look at the retention and or dynamics of the virus in the sewer network? For example, the virus sticking to the walls of the pipes or sewer pipelines and getting slowly released over time, or how an infectious flush actually looks. Does it pass a collection point all at once or at the low level over a given time period? This is a very good question.
Yeah. I surrender.
Please go ahead. What do you think? Or have anyone studied on that, you know?
I mean, I'll just say we have not studied it. I don't know. But what we do know is from our single cases within a community that is very well documented, very well understood, and we had a single case confirmed. I mean, we detected that at the right time. It didn't seem like there was any sticking to walls or any slow release when the patient was recovered. We even know the patient's history from when they were the onset of symptoms to when they went in and had the positive test, etc. So the pattern that we saw in the wastewater matched the clinical data spot on. So I don't think there's any lingering. Once that patient left the community, the signal went back to zero, non-detect.
Yeah. So the question
we have another experience also with nursing homes where there's only a few people infected, but then we did sometimes see a lagging signal in the sewage, but we wonder whether more people were actually infected than were reported. So that's a different example, I think. Yeah.
Right. I think this question is going to be very difficult to answer unless you know exactly this person infected, go to the toilet, and by when can you detect or what happened to that discharge, you know? Can you, if you don't capture that discharge, what will happen, you know, over time? Do you able to detect that? That's it's an interesting question.
One aspect of it is certainly is about accumulation. I mean, I have put a little bit hypothesis to defend my results that when, I mean, because we know that we are talking about non-viable genetic material and it is very resistant. So if it is reaching to the treatment plant over the time, it seems to be is getting, accumulated in certain ways. So I mean, the initial year until August there was no in the effluent, but after that it start effluent. So I feel like the sink has become the source, and that is also being. But yeah, that is. So I feel that that is some sense of such kind of accumulation is happening.
Okay, wonderful. Thank you very much for all the participants. Continue to raise questions, and thank you for the panelists' active participation. So now it's 9 p.m. and we will take a 15 minutes break. Then we can resume dialogue session 2. Thank you very much. Before you leave, can we have the panelists or all of us take a picture together? Let me see how to do this thing.